Hello and welcome to week 1 of PA 120, Pharmaceutical Management 2. In this class, you are using the Pharmacy Technician book by Cengage. So make sure that you have placed an order for that so that we can get studying going. If you don't have your book, no problem. There are 2 chapters, the chapters that we're starting with, 19 and 20, already in your modules. And so go ahead and download those and start your discussion and your assignment, and then your book should hopefully be there by the end of the week. If not, please let me know. All right, guys, so we are starting in chapter 19 and 20, and what I love most about these chapters is we're really diving in to the different systems in our body. And so we're actually giving you clinical trials for your assignment to answer what would you do if this case came to you. And so I love that you get to really answer on what you've been reading and learning on. So chapter 19, we're starting with the eyes, learning all about the anatomy of the eyes. We're learning about the medications that you can put in the eyes. There's a really important box there that I want you to look at of the abbreviations that you will need to know when you are reading a prescription from a doctor who's writing for an eye drop or an ear drop. I want you to be able to read those abbreviations. So those are very important for you to know later on your certification test. They talk about abbreviations to know and abbreviations not to know, and I want you to know both of them. So then it goes on and talk about some of the steroids that can be used in the eyes and the anti-inflammatories like the NSAIDs, which you wouldn't think would be used in an eye, but yes, they are. They can be used there as well as taken orally, that kind of thing. It goes, chapter 19 then starts to talk about the ear and the auditory canal and all the anatomy of the ear. So make sure that you look over that. And then it talks about the medications that may be an eye drop that can actually be used in the ear, but you can never highlight, this is a certification test question, you can never use an eardrop in your eye. You may use an eye drop in the ear, but never an eardrop in the eye. Weird, right? Take it to the certification test. I bet they ask you that on your assignment or on your test. Anyway, so excuse me, learning about that and both of the eyes and ears and all the medications to go with it. Then there's some clinical trials, like I said, in your assignment of how would you treat this person if they came to you with this type of symptoms. And I'm loving that you can then put, I would treat with this kind of medication, or maybe it's an over-the-counter medication that you would want to use, or maybe it's non-medical. So add some of that in because that is what these chapters go into. Chapter 20, we're talking about the integumentary system. The entire chapter is about the integumentary system, which, if you don't know, is our skin. The biggest system in our body is our skin. And so there's a lot that our skin can tell about what's going on the inside. And so this is what chapter 20 is talking all about. So make sure you read that closely. It starts with some rashes and then goes into acne and then warts and things like that. So make sure that you look at that. The biggest thing about the skin is that it is the biggest part of our body, the biggest system in our body. So make sure that you know that. Remember that. And then your discussion question, which I love, is for our first week because it gets to us to really know who each other is. The discussion question has no right or wrong answer. It's basically, what is your opinion? And how would you handle this situation? And because we are all different, we're all going to handle it differently. And so I will add my discussion in the discussion because I don't want to tell you the answer right here in the instructor log, but it asks if you would go to a fridge and you noticed that it wasn't working and you were trying to pull out a medication from it, what would you do? Now remember, put yourself in a pharmacy technician's position. You're very busy. I'm trying to grab it and fill it and get it out. Make sure that these vaccinations, I think that it is, they're talking about, is sent up, the nurse can use it, the patient can get it, and I'm busy. Do I have time to deal with a broken refrigerator? And if I do, what would I do? So I can't wait to hear your answer. Make sure that you check out mine, and remember that that is due by Wednesday. I hope you have a great week. If you have any questions, please feel free to reach out to me, and I can explain anything in detail. But I'm really loving that we are jumping right into the case type. So hold on. This is what this program is all about. You're really just jumping from topic to topic, and it's interesting. So hold on for the ride for these next 10 weeks. Talk to you soon. Bye-bye.